Hey everybody, and welcome back to the Tonic Accord podcast. I'm one of your co-hosts, Alex Kapitko, and thanks for listening today. To start things off, I just wanted to say that things are going to be a little bit different in this episode. For a while, Drew and I have been discussing the idea of adding shorter episodes a couple times a week. These will look more like short episodes that are less discussion-based and more focused on a topic, and we can alert people on current events happening around the world. But then Drew and I can also have our more in-depth two-person discussions, which are longer episodes bi-weekly. I thought it was a good idea to begin this short update this week because of an issue that is escalating quite quickly. And I bet you know what it is, and I bet you guessed it. It's the coronavirus. The reason I want to talk about this today is because I'm coming to you guys from Madrid, Spain, and I must say that things are getting quite different quite quickly. Much like what happened several weeks ago in northern Italy. In the community of Madrid, the government has shut down all public schools and universities, and the community has also suspended the first two divisions of the Spanish football league, La Liga. And there are also growing whispers that there could be a potential quarantine of the community coming in the near future. These issues are not only happening in Europe, but I wanted to touch on them because they have become relevant to daily life and are likely going to change many things in the week to come. I have also seen in the last 24 hours that in the United States, the National Basketball Association, or the NBA, has suspended the NBA season after the Utah player Rudy Robert tested positive for the virus. And Tim Reynolds of the Associated Press has announced that these games will be suspended for at least 2 weeks. The United States has also responded to the growing concerns in Europe by declaring a travel ban from Europe to the United States. According to The Guardian, President Trump has announced a ban on travelers to the U.S. from Europe. This ban will take place for the next 30 days in efforts to slow the disease. However, many experts debate the idea that a travel ban will actually stop the disease, mainly because it could buy time, but it's very unlikely to do much more than that. A lot of experts say by the time you are picking up large numbers of the disease, it is sometimes too late to do a travel ban. And I think it's become very inevitable that this coronavirus is here to stay, and the next several months are going to really test our infrastructure and the way our daily lives are run. It is becoming more and more apparent that many nations are starting to consider some form of a lockdown or quarantine. Clearly, we have seen a very large quarantine in Wuhan, China, that was considered very successful and one of the biggest quarantine mobilizations in human history. It does need to be noted, though, that Wuhan and the Chinese state were able to do this because of their one-party authoritarian apparatus. It is something very unique to China that we do not see in other parts of the world, especially in the West, because there are more ideas of individual and personal freedoms and liberties. And obviously a quarantine or lockdown is going to test some of those. So, a lot of people have talked about Wuhan having a lockdown and quarantine, but also ideas are spreading outside of Asia and into places such as Italy. As of Wednesday, Italy, which has been the most affected outside of Asia, has taken very strong measures and has escalated its own quarantine measures. The government has announced the closing of businesses, shops, and all non-essential services, and this is in a very desperate attempt to halt the spread of the disease. I want to make it clear they're not trying to stop the disease, they're not trying to turn it around, they are just trying to slow down the impact on their hospitals. And this is because, according to the Washington Post on Wednesday, the death toll has already risen to 827 people. And the region that has been hit the hardest is the northern region of Lombardy. And they are actually proposing what they call, in quotes, the Wuhan model, according to the Telegraph. This would be a very draconian attempt to shut down the north and would be very unprecedented outside of China. And I think the reason why Italian leaders are discussing such drastic quarantine and lockdown measures is mainly because their fear of the collapse of the healthcare system and the hospital system. And obviously this issue is unique to Italy right now, but I hope it's not a lesson for things to come. According to the Washington Post and BBC, the system is already collapsing in northern Italy. There are many reports coming out of the northern parts of a failing healthcare system and bodies stacking up. That's right, I say bodies stacking up. An Italian actor, Luca Franzesi, I'm probably butchering that name, has said that his sister died from the coronavirus and he has been trapped with her decaying body for more than 36 hours inside of his house because he is unable to receive help or a funeral home that is willing to bury her body. And there are other reports on how Italian hospitals are now becoming unable to tend to everyone. According to Yasha Munk at the Atlantic, doctors and nurses are simply unable to tend to everyone. They lack machines to ventilate all of those grasping for air. In a very startling step, the Italian College of Anesthesia has also published guidelines on the moral choices that could be looming ahead. The documents liken the decisions the doctors will be facing to wartime ones, in which they must care for the necessary people based on the limited resources they have. To me, this is quite scary and shows the direction that I don't want to see other countries going down, but it does show the desperate situation ahead. This shows what happens when a country with a highly transmissible virus spreads rapidly through its streets. Hospitals must take utilitarian measures to help the most they can with the limited amount of resources they have. This sadly means that older people with a lower chance of recovery could be left to die. And that sounds horrible, but the alternative is also horrible. And I think this situation that is growing in Italy is a good warning to the rest of us. The Atlantic says that this issue hits home for the United States right now, considering the problems that they are also starting to face. In quotes, it says, "The obligation facing the United States is very clear. They need to arrest the crisis before the impossible becomes necessary." And I think that is a crucial point and why I want to bring up quarantines and lockdowns. Because I think many countries will need to begin enforcing some form of a lockdown or quarantine. And this doesn't mean always state-mandated ones where you cannot leave your house, but they could also mean self-quarantine, public isolation, and just avoiding large amounts of contact with one another. USA Today says that according to many health experts, canceling public events and possibly even the movement of people, especially when they aren't sick, is crucial. And I think it's important to mention this because it is all linked to the numbers and how quickly they are growing. Obviously, right now, this virus is doubling at a very high rate, and health officials say that we need to avoid a rapid spike in cases that can overwhelm the system, much like we've seen in Italy. Basically, what this means is that we need to work on the idea of flattening the curve, which could be crucial to spreading the cases out over a longer period of time. That way, the system can react and better prepare. I've heard people joking, saying, "Oh, I'd rather just get the coronavirus now, get it over with." But actually, most numbers show that the longer you don't have it, and this flattening of the curve, as they call it, occurs, less people will get it over a longer period of time, and so the system is more prepared. So it is for this reason that self-quarantine, social distancing, or even some forms of quarantines and lockdowns may be effective, not in stopping the problem, but buying time. So in general, I think this is going to be an interesting situation over the next couple months. Quarantines in the West will be very different than the one that was orchestrated in Wuhan and other parts of China. This is going to test what many people view as individual freedoms in the West. But I think as individuals, we need to understand that cooperation will be key. Work from home, stay home if you have a cough or fever, wash your hands, and avoid non-essential public activities. These are all things that can help us get through this. But as humans, I think we are resilient. We can evolve to situations, and once we accept the fact that our daily lives are going to change, then we can move forward and take the precautions necessary to get through this. And with that, I want to thank you guys for tuning in, and you will catch Drew and I later on in the week for one of our normal podcast discussions. So with that, keep it safe, don't shake hands, and have a great rest of your week.